I'm Dr. Farah from Opus Dental Specialities, and today we'll be talking about two popular cleaning methods, the conventional scaling versus the EMS Airflow therapy. Ever wondered which one is best for you? This video will answer all your doubts. Let's begin with the conventional scaling method, where we use an ultrasonic tip, which is metal, and it vibrates and helps clean the plaque and tartar which is stuck on your teeth surfaces as well as below the gum line. This has been a gold standard for decades. Patients often find this technique a little uncomfortable since it causes teeth sensitivity, bleeding gums, and also pinch sensation when we clean around the gum line. Now let's talk about the revolutionary EMS Airflow therapy. This method uses fine powder, water, and controlled air pressure to remove the plaque and biofilm. It also uses a piezo handpiece to remove the tartar which is lodged inside the gum line. This method is non-invasive, gentle on the gums, and does not feel like teeth scraping. So there is literally no sensitivity. Our patients love it, and it feels like an absolute dental spa therapy. Here's how they compare. While both methods are effective, EMS Airflow stands out for its comfort, efficiency, especially for routine cleaning and patients with sensitive teeth. So how do we choose? If you haven't had a dental cleanup for a while or have significant amount of tartar buildup, then conventional scaling would be a great option. However, if you're looking for a gentle treatment with no pain, then EMS Airflow therapy would do you good. At Opus Dental Specialities, we specialize in pain-free dental care. We have the state-of-the-art EMS Airflow technology, which will make your cleaning appointment enjoyable and efficient. Thanks for watching. If you are ready to experience a revolutionary cleaning method, book an appointment with us today. Let's make your next dental visit something to smile about.